I remember on my first day just looking around and kind of being in awe.
These people were the most innovative that I'd probably ever met. And so I was hoping that by coming to Johns Hopkins, maybe some of that would wear off on me.
The amount of opportunities that Hopkins offered in terms of research.
Like the positive attitude towards being a physician scientist.
It's just amazing to be next to a lot of these doctors that are on the cutting edge of surgical techniques.
This place where, medical miracles happen.
I am surrounded by clinicians, by physicians who are so passionate about the work that they're doing. It has just been an unparalleled place to train.
When I was in middle school, my grandmother unfortunately passed away. So my coping process for, dealing with my grandmother's passing was to learn more about the problem and to solve it in the future if I could.
I grew up with my uncle. He's a doctor in El Salvador. He was born out in the countryside, and he would go back every few months or so. And so the folk would come up to him and ask him if they could see him because of an illness or their child was sick. And he never declined anybody, never charged anyone for it. I just remember that I took that home with me forever.
I joined Teach for America right after college and saw the way in which societal and economic factors were impacting my students' ability to succeed. And so I left the classroom really convinced that I wanted to work as a physician to help support health in vulnerable communities.
When I started volunteering at Walter Reed, I got a chance to see and interact with wounded warriors, people who had gone through traumatic brain injuries, amputations, and seeing the work that the doctors were doing really moved me and made me want to be able to be in a position where they were in.
I have a PhD in radiation physics, and I started doing research projects that were more and more directed towards patients, looking at outcomes and things like that. So that led me down the path of applying to medical school, and when I was accepted to Johns Hopkins, we knew that my wife was pregnant, so we knew that could be a potential challenge. Johns Hopkins is an excellent school, but I'm not gonna lie, it's expensive.
So receiving a scholarship was definitely one of the factors that helped me choose Hopkins.
It gave me the chance to select somewhere where I could be able to achieve almost anything that I could dream of achieving.
It allowed me the freedom to pursue a primary care track, to graduate with a minimal amount of loans.
It means the world because it's a wonderful gift, and it's a gift of education that is probably one of the greatest gifts anyone can give.
And if it weren't for you, then I wouldn't really be here in the first place, So I feel like you've changed my life for the better, and I really want to thank you a lot for that, and somehow later on in the future pass it forward.
In the future, I would love to do something abroad internationally, and for me, ophthalmology is really interesting because the eye is such a small organ, but there's so much that you can do in terms of correcting it.
I'm interested in interventional radiology because many therapies that used to be done under open surgical intervention are now done with very minimally invasive techniques. In a lot of ways, it's the future of medicine.
I started building this stent that would treat laryngotracheal fibrosis, and hopefully in 2 or 3 years, we're going to be doing the potential clinical trial.
I envision myself as a pediatrician working to provide direct patient care, but also continuing to address some of the systemic problems from a more population level.
And I think just having the knowledge, but taking it forward, taking an extra step forward, being compassionate about it, and really getting to know the patients.
Just getting a chance to be able to help people who are going through a lot personally and giving them a chance at having the most important thing in life, good health.